So next up we have Narayana Hrudayalaya, which is for easier sake, it's also known as Narayana Health, which they have rebranded to, so it's easier to pronounce.
Manya
Basically,
has been practicing this over the last 1 month, so
yeah,
just to learn how to pronounce it.
yeah,
It's an Indian business, and Hrudayalaya basically means a heart center. It's very interesting business. Listen up.
yeah. It's a private multi-specialty hospital group founded and listed in India, and I'm sure Ate here knows a lot about it. First, let's talk about why do we even care about looking at healthcare companies in India and how big the opportunity is in terms of tailwind and runway. According to a scientific paper in 2020, non-communicable diseases like cardiovascular disease, cancers, chronic respiratory illness, and diabetes accounted for about 60% of all deaths globally. And a lot of these deaths actually came from India, which accounted for about 1/5 of the global death, with Indians being known to have the highest coronary artery disease rates relative to other ethnic groups due to various reasons. And with Indians being genetically 3 times more vulnerable to heart attacks compared to Caucasians. Therefore, there are tremendous health issues in India, including relating to cardiovascular diseases, which contributed to about 28% of total deaths in India, and with many Indians having to be hospitalized and treated for various health issues. However, the high demand for healthcare is currently very underserved in India. As of around 2023, the number of doctors per 1,000 people in India was only 0.9, which was half of the global average of 1.8, and much lower than many developed countries. And the number of hospital beds per 1,000 people was also low at around 0.5, with the Indian government targeting it to reach 3.5. Therefore, the penetration of healthcare services is currently very low in India relative to other countries, thereby providing a very long runway of compounding for the healthcare industry in India. In addition, India currently has a large chunk of young populations, and as they grow older and face higher risks of medical conditions, and with their economic power improving as the country develops, that will increase the overall demand for healthcare services in India, providing tailwind to the healthcare businesses in India. What is interesting is that despite being a developing country, India actually has one of the best medical care quality and innovation in the world. In September 2023, a hospital in India gained world recognition by winning the Guinness World Record for conducting the most number of electrocardiogram screenings, or ECGs in short, in a single day, and that is Narayana Health. Not only in terms of scale and execution, Narayana Health's innovative way of handling health operations by scaling up the scale of operations in each hospital to drive down costs through economy of scale, and reducing complex, expensive procedures to manageable and affordable tasks in an assembly line structure, which we'll talk about in more detail later, has gained global attention, where Narayana's model is actually being studied by various professors globally and used as case studies by the Harvard Business School and by the Commonwealth Fund, and with some countries actually studying Narayana's model to see how they can replicate similar models in their countries to improve their healthcare provision. Overall, globally, India is recognized as one of the top countries for heart surgeries in terms of both quality and cost, together with other developed countries like the US, Germany, South Korea, Singapore, and Japan. In terms of cost, as of 2019, India was one of the cheapest countries for a heart bypass surgery, costing only about $8,000, much cheaper than the US, which cost more than $100,000, and also quite much cheaper than the other developing countries, thereby making India an attractive destination for medical tourism. And this medical tourism acts as a potential optionality for tailwind and runway for quality healthcare companies in India like Narayana Health in the longer term future. In terms of quality of surgeons and surgeries, Narayana's quality is actually comparable to the US, if not better, despite charging only a fraction of the price charged in the US. In terms of mortality rate within 30 days of cardiac surgery, it was around 1.4% for Narayana, and this is lower than the 1.9% for US average. This can be attributed to the fact that due to the large amounts of patients in hospitals in India and Narayana's production line approach, the cardiac surgeons in Narayana's hospitals perform very high volumes of cardiac surgeries every day, of 30 to 40 surgeries daily, which allow them to hone their skills fast and perform surgeries well. And with Narayana's Health Pediatric Cardiac Program actually being the largest in India and one of the largest in the world. In addition, due to India's very large and heterogeneous population, the variety of cardiac cases in India are more diverse compared to other countries, which allow the surgeons in Narayana to gain diverse experiences and mastery more quickly, training them to be even better surgeons. So these factors result in the overall high quality of doctors in India, which is what makes India one of the top medical tourism destinations providing tailwind to the industry growth in India. According to a medical journal article in 2012, a trainee cardiac surgeon in London went to India to work in Narayana's hospital for 9 months to get practical experiences, as there was a lack of opportunities for hands-on experience in London. And at the end, the trainee said that the workload in Narayana was so massive, with him doing much more in his last 2 months in India than what he had done in his previous 10 years. And such experience is a heaven for surgeons. Within India, Narayana Health is one of the top heart hospitals with strong branding, with its hospitals having good reviews on Google Maps. Having a strong branding in such a large market with strong runway and tailwind means a lot of opportunities for Narayana to compound its growth for a long period of time. Narayana's high quality of service has also been recognized by the Joint Commission International, or JCI in short, which is a non-profit US-based international accreditation organization that certifies healthcare companies' services and programs. JCI's accreditation is recognized as a gold standard for patient care and safety in the international healthcare community. And as of September 2024, there are 55 healthcare institutions in India that were accredited by JCI, and 8 of them belong to Narayana's hospital. And what's special is that Narayana has not only achieved the individual JCI accreditation for 8 of his hospitals. In 2023, it also achieved a significant milestone of attaining the prestigious JCI Enterprise accreditation for its enterprise-wide operational legal. Narayana was the first healthcare chain in India to achieve this distinction, and the 6th globally, which speaks to the quality of its services not just in India, but globally. Narayana's branding also benefits from the strong reputation of its founder, Dr. Devi Prasad Shetty, who is a well-recognized cardiac surgeon and business person. And I'm sure everyone here knows Mother Teresa. So Dr. Shetty was also a personal physician of Mother Teresa after operating on her following her heart attack. Dr. Shetty has also received a number of national and international awards, including the Padma Bhushan Award in 2012, which is the 3rd highest civilian award in India, received for his contribution to the field of affordable healthcare. So the overall strong branding of Narayana Healthcare and Dr. Shetty helped Narayana to attract patients and healthcare professionals to grow its business while earning high return on capital. On top of this branding mode, there are also other modes supporting Narayana's high ROCE and growth, which we'll talk about later. And so by now, I hope you get an idea of the quality of healthcare in India, the size of opportunities presented by the healthcare market in India, and the quality healthcare operators there, and how Narayana is in a good position to take advantage of these massive healthcare opportunities in India, and also outside of India, like in the Caribbean and Americas, which we'll talk about shortly. For now, let's quickly understand Narayana's business and operations first. So Narayana Health was founded in year 2000 by Dr. Devi Prasad Shetty, a renowned cardiac surgeon then. After graduating from a medical college in India, Dr. Shetty went to the UK to practice as heart surgeon in Guy's Hospital in London, which was one of Europe's best cardiac centers. In the late 1980s, he returned to India to set up the cardiac surgical unit at BM Birla Hospital in Kolkata, in the east of India, where he was the only heart specialist in the city. And after realizing that, unlike the UK, many patients in India could not afford heart surgeries, he decided to bring low-cost cardiac surgery to the people in India in year 2000 by setting up Narayana Hrudayalaya, a 280-bed hospital in Bangalore in the south of India. So Dr. Shetty set up Narayana Health with a mission to deliver high quality and affordable healthcare services to the broader population, and not just the more well-to-do people, by leveraging on economies of scale and efficient operating model with streamlined administrative and clinical functions and process innovation, and a pool of skilled doctors to deliver the healthcare services at low cost but yet high quality. The idea is that generally, a large part of hospitals' expenses come from fixed expenses, like building and maintaining the hospital infrastructure, blood banks, and laboratories with expensive machines for CT scans, MRI scans, PET scans, and the salary of skilled doctors. And by having larger hospitals with more beds and spreading the fixed cost of medical equipment and doctors over a larger pool of patients, it helps to drive down the cost to produce healthcare services. For example, according to Dr. Shetty, the cost of heart surgery when he did his first operation back then was around $2,000 adjusted for inflation. But that cost has actually come down to the low $1,000 over the years, partly due to the economies of scales at play, which has helped a lot in improving the access of healthcare to the broader population in India. And since the first hospital in Bangalore, or also called Bengaluru in this map, in the south, in year 2000, which focused more on cardiac surgeries, Narayana Health has now expanded to about 18 hospitals, 3 heart centers, and 17 clinics and dialysis centers, with about 5,700 operational beds across multiple locations in different states in India, as shown in this map. Narayana has a particularly strong presence in the southern state of Karnataka, with the revenue from Bangalore making up about 35% of its India revenue, and also in the eastern state of West Bengal, with the revenue from Kolkata making up about 35% of its India revenue, as shown by the revenue breakdown by cluster chart on the bottom right of this slide. And then, in terms of services, as shown by the bottom left chart, Narayana hospitals have expanded from mainly focusing on cardiology and cardiac surgery to now multi-specialty hospitals providing advanced levels of care in over 30 specialties, including oncology, which is cancer care, gastroenterology services, or GI in short, nephrology and urology, dealing with renal diseases relating to kidneys, neurology and neurosurgery, and also orthopedics. And in terms of the ownership of the hospitals, as shown in the top right chart, Narayana owns some of its own hospitals and the land, and it also operated hospitals with the capital for the land or building provided by the other parties, and with Narayana purchasing and owning the medical equipment and then operating the hospital and paying rents or having some revenue sharing agreements with those parties to make it more capital-light to expand fast. Besides India, Narayana also has operations in the Cayman Islands, where in year 2014, it partnered with an American faith-based healthcare organization called Accession Health Alliance to build a 101-bed tertiary care hospital in the eastern area of Grand Cayman that follows the Narayana model in India to cater to the market there, and in the future attract patients from the other parts of Caribbean or North America, where the prices there in those markets are higher than in the Caribbean. So the choice of Cayman Islands was driven by a convergence of factors, including the enthusiasm of local business leaders, the Caymanian government's need to diversify its economy after the global recession, and Narayana's belief that it could replicate its low-cost business model in India in that market, thereby offering much better price for value relative to the hospitals in the US. And that Narayana can offer this to the residents in the Cayman Islands who used to have to fly to the US for more specialized medical services or operations that were not available in the Cayman Islands. To achieve low cost, Narayana leverages on its relationships with suppliers in India and procures and imports medical equipment and medicines into the Cayman Island at lower cost compared to the competitors in the US. It also managed to build its hospital there at a lower cost per bed than the US, and to provide the supply of good doctors in that markets where local talent was minimal. Narayana transferred its high-performing doctors who have gained lots of experience in its Indian hospitals to the Cayman Islands. Okay, now coming back to Narayana's overall business and its financials, its total revenue has been growing well consistently over the years, except for financial year 2021 when it was hit by COVID-19. One good thing about Narayana's business model is that because healthcare services are essential services, they are generally resilient throughout economic cycles. For Narayana's operating and net profits, they have been fluctuating in the earlier years, as Narayana have been investing in new hospitals and there were front-loaded investment on expenses like DNA, fixed salaries for medical expenses, medical personnel, and also interest expenses on debt taken up for the expansions. And it takes time for new hospitals to build up reputations and utilization, especially in newer geographical areas where Narayana did not already have a presence, where generally it takes Narayana about 2 to 3 years for a new hospital to break even and then start earning positive profits. Now let's look at the ROCE for Narayana Health. It had achieved a ROCE of more than 20% in the past 3 financial years, and prior to that, its ROCE had been low, partly due to the front-loaded investments while the new hospitals were ramping up. And in financial year 2024, its ROE was higher than its ROCE at high 20% due to the use of debt leverage, and its ROA was also quite high at almost 15%. Compared with the other hospital chain competitors in India, like Apollo Hospitals, Max Healthcare, and Fortis Healthcare, Narayana Health has the highest ROCE in terms of ROCE, ROA, and ROE based on this rough data from the Screener India website. The heavy reinvesting has led to strong compounding of its operations and financials since its IPO in financial year 2016. From financial year 2016 or 17 to financial year 2024, its revenue had grown by a CAGR of about 15%, while EBIT and PBT had grown by about 30% annually. Net profit CAGR was higher due to a decrease in tax rate, which is less representative of the overall underlying operating growth. One thing to note about capital allocation is that so far, Narayana's operations in the Cayman Islands pay no income tax and have been mostly reinvesting the capital generated back into Cayman Islands and then retaining the excess capital there instead of returning the capital back to India through dividends, which would otherwise attract a tax of about 17% to 20% depending on the use of the dividends. Narayana is currently trying to look for opportunities to reinvest outside of India to not incur the repatriation tax But if in the future, if you have to move the existing excess capital or future capital generated back to India, then the final capital return will be reduced by the tax payments.
For the remaining points of this video, you can check them out at our multi-bagger research series. At MoneyWise Smart, we do deep dive research into wonderful companies to own for the long term. We have provided some of this research for free in our free research series, so definitely check them out at the link provided if you want to invest in good companies. I promise you will really benefit a lot from this research. If you have enjoyed this video, do hit the like button now, and don't forget to subscribe and hit the notification bell so that you'll be notified of our future videos. Do also join our Facebook group where we discuss interesting investment concepts and businesses. Thank you for watching, and see you in our next video.